Hello, my name is David Cogley. I'm one of the orthopaedic surgeons here at the Hermitage Medical Clinic. We'd like to welcome you to our joint school for knee replacements. Knee replacement surgery is probably one of the most successful operations that we have invented over the last 100 years, and the vast majority of people are very happy with their knee replacement. Knee replacement is major surgery, and therefore, as any major surgical procedure, can have a risk to you in terms of putting pressure on your system and on your heart or your brain, and perhaps causing a heart attack or a stroke. This is common to all major surgical procedures, and it is important that you attend our pre-assessment clinic, where we do our best to make sure that you would be fit for such surgery. Heart attack or stroke or other major medical complications are very rare after elective knee replacement surgery. The other risks are blood clots in your legs, which are not uncommon after major orthopedic surgery, either hip or knee replacement. We do lots of things to try and prevent that from happening. You will notice that you will have foot pumps on your feet to simulate walking and keep the blood flowing through your legs. And these can be a little bit uncomfortable or annoying, particularly on the first night or two after the surgery. However, it's very important that you persist with this. We also will arrange for blood thinners, so you will have injections while you're in hospital, and you will go home on blood thinners for a period of 4 weeks afterwards. With all of this, we can reduce the risk of blood clots to around about 3 to 5%. Those blood clots can cause swelling in your leg, but our main concern is if that blood clot should travel from your leg to your lungs, and that is called a pulmonary embolism. The risk of pulmonary embolism after knee replacement surgery is between 0.5% and 1%. The other risk after any implant surgery that we're concerned about is infection. What we place in your knee is made of metal and plastic, and it doesn't have a blood supply. So the body finds it very difficult to fight infection if bugs get onto the implant surface, because it cannot deliver the foot soldiers or the white blood cells to fight that infection. If this happens, it's a disaster both for us and for you, because it means that in order to control the infection, we would have to remove the implant, get rid of the infection, and then go back again to give you a new knee replacement. Fortunately, this is very rare, and our infection rates are between 0.5% or 1%. This would be slightly raised in patients who have diabetes or in patients who are on immunosuppressive therapy for their arthritis, such as patients with rheumatoid or psoriatic arthritis. Knee replacement is a little bit different to hip replacement in terms it tends to be sorer. We've got significantly better at managing the acute pain around knee replacement, and maybe 10 years ago knee replacement would have been regarded as a very painful procedure. Yes, it's a somewhat painful procedure now, but it does tend to be sore, and it does tend to be sore for quite a period of time after the surgery. So it's not unusual for the knee to be sore and swollen for a period of 6 to 8 weeks, even up to 3 months after the surgery. It's important that you use ice and your anti-inflammatory medications to control the pain and the swelling in your knee, particularly in the immediate post-operative period. How long will you be in hospital after the surgery? Most patients will go home from hospital within about 2 to 4 days after the operation. Here at the Hermitage Clinic, we use a criteria-based discharge to allow you to go home. This means that in order to go home, you have to be able to perform activities that you would normally do at home. So we let you go home when you're independently able to get in and out of the toilet and shower from your bed yourself on your sticks, when you can go up and down steps and stairs yourself, and when you can walk 50 meters on your sticks. When you do go home, it's important to remember that you have had major surgery, and while we want you to do the exercises that the physiotherapist will show you, and we want you to be active, we would like you to be active in small increments and be active little and often, as opposed to going out and doing a 5-kilometer walk on the first day home from hospital. It's also very important that you rest. In general terms, we would say, and I would tell most of my patients, that it will take about 3 months for you to feel that it's been worthwhile having the knee replacement in terms of pain and swelling and the knee being quite irritable. And it takes about a year for the knee to be as good as it's going to be. We'd welcome any questions that you have on the replacement surgery. The more people that ask questions, the better, because your neighbour will think of questions that you haven't thought of. So please feel free to ask the questions, and we will try and answer them for you. Wish you luck with your surgery, and we look forward to seeing you shortly.